that the demand on the National Health Service, particularly as a consequence of the increase in caseload because of the cancellation of procedures during the COVID pandemic, has increased the presentation of demand on the National Health Service. And we are working to reduce those waiting times and those waiting lists to ensure that people get treatment at an earlier time than is the case just now. But I do have to say to Anas Sarwar, I think he's on very, very thin ground in challenging me on the question of private involvement in the National Health Service. Let me just remind him of the comments of Labour's Shadow Health Secretary Wes Streeting, who said that a UK Labour government would, and I quote, hold the door wide open for the private sector in the National Health Service. He said also, we will go further than New Labour ever did. I want the NHS to form partnerships with the private sector that goes beyond just hospitals. Now, what we have here is a classic example of what Anas Sarwar gets up to in public debate. He comes here in Scotland and says one thing, and in England his bosses are doing a completely different thing, which will have an effect on our budget here in Scotland. And Anas Sarwar has already been caught out on this week. It's not good enough to say one thing in Scotland and be contradicted by your bosses in London.
Anas Sarwar.
Frankly, that is a frankly embarrassing response to the fact that 3,000 people in Scotland have had to pay £14,000 for a hip replacement. And let me quote, Mr Swinney wants to do quotes, let me quote two simple sentences from the UK Labour manifesto published today. Direct response. We saved the NHS before, and the next Labour government will do so again. With Labour, it will always be publicly owned and publicly funded, not more people going private under the SNP. And let me also quote another sentence. There will be no return to austerity. So stop the scaremongering, stop the misinformation and be truthful with the people across Scotland.